I've been in practice 18 years now, and I recognize that happiness in medicine really does matter. Physicians have to recognize that you can't give what you don't have, and we can do better for our patients if we learn to nourish ourselves and our inner needs. I like to ask doctors to consider two questions. How happy am I? And what am I doing to feed my soul? I've learned that the art of self-nurturing has paid dividends with me and my patients. The message I want to give doctors today is that you can't give what you don't have. And if you're not sleeping, if you're not getting exercise, you're not eating well, I think you're kidding yourselves. My recovery as a doctor, and this is one who's been through difficult malpractice issues and so forth, and insurance hassles, and sort of the rigors of working in an inner city, predicated on just back to fundamentals. Comedy and humor are very much an important part of my life. Physicians also need to work on relationships. Relationships matter, and you have to be mindful of what you bring to work, because what you spread around comes back to you. And maybe the most important thing I like to talk about is your family relationships and the medical marriage, how important it is, and the sanctity of that marriage in terms of nourishing your soul and enabling you to give to your patients. And we also have to work from a principle center and realize what we can and can't control. Faith is very important to me and to those I know that are resilient, and recognizing that certain things we have no control over. And if you work from a spiritual core, a center of principles, then there's nothing really the world can do to hurt you. And ask yourself the question, am I blessing or stressing? So be careful what you spread around to your office staff, to your residents, to your coworkers, because what you spread around does come back to you.